Yeah,
This
ma.
conference
So
will now be
last
recorded.
class, I think last class we just started with the biological factors, okay, and I just told you what are the three biological factors which are quite important, okay, and I also can anybody be able to tell what are the biological factors we considered to be
The
important?
biological half-life,
Which
absorption,
one
and
we
metabolism.
discussed? Yeah, excellent, pa. And we also just I just told you what are the other physico-chemical factors which may be important, some of them at least, okay, because there are many other physico-chemical factors as well as biological factors which may influence what you can call it as selection of drug candidates. Even that we listed out, and we just started off with what you can call it. Hello, yeah, is it clear?
Yes, sir.
Hello, hello.
So now it is
Yeah,
clear,
we'll
but
start, ma. Okay, Aditi, anything is there? Feel free to tell, pa, so that I can also
okay,
correct
sir.
at my end. Yeah. So, yeah. So, biological half-life was the first one what we considered. So, biological half-life is the most important criteria, as I told you, and biological half-life, it in turn, what you can call it as, affects the rate of delivery. Okay, it's very important. And I also told you biological half-life is governed by what you can call it as ADME. That's what I told you the other day. Or the pharmacokinetics of the drug is governed by absorption, okay, distribution, metabolism, as well as elimination. Of course, the rate of each one, okay, which in turn will determine the pharmacokinetics or indirectly the half-life. So, biological half-life we identified for our convenience, especially for the convenience of this chapter or for the convenience of a formulation scientist, what I can call it as. We classified them into three categories, if you can recall. Okay, you remember what are they? Somebody can highlight about that. What are the three classes of drugs? It's there on the slide. Anybody can tell? I need people to reciprocate. If you have written it down somewhere, you'll be able to recall. Yes, anybody, are you able to hear me?
Yes, sir.
Yes.
Ultra short acting, long acting, and short acting.
Yeah, excellent, ma. Excellent, pa. Okay. For our convenience, that is. Okay. You need not think it's an what you can call it as universal classification. For the formulation development scientist, this is the classification what you need to look at. Okay, as you rightly mentioned. Is it who is this? Who is the one who gave me the answer?
Hiral, sir.
Hello?
Hiral, sir.
Hiral. Yeah, excellent, ma. Okay. So yeah, I got your point. I could make out from your voice, but again, I'm not familiar with your faces. So that's a problem with me. Okay, is it clear? So for our convenience, we classify the drugs into three categories. Okay, ultra short acting, and long acting. Okay, so which one is best suited for controlled release or sustained release? Yes. Which one is the most suitable?
Long acting.
People should tell or try to tell at least.
Short acting.
Long acting.
Any other answer? Who is long acting now? Who is telling long acting? Yes.
Me, sir.
I'll try to correct. Nothing else. Who is that?
Tanuja, sir. Tanuja, sir.
Yeah, Tanuja. It's short. Yeah. Got your point, ma. It's short acting, pa. Please correct yourself. Okay. Neither
sir.
ultra short acting. Okay, nor long acting or suitable. I also told you the reason for that. Ultra short acting, what I can do is that at this point, the limitations with that is that they invariably require a huge dose. Yeah, they invariably require a long dose. They invariably require, because they are ultra short acting, they require a large dose. Okay, and that is the reason what usually the convenient dose. I'll discuss again the dose. What can be the most convenient dose? Anybody knows? For example, what can be the most convenient dose for a tablet? It's a general question, pa. It's a general question to all of you, because all of you, I'm very sure, would have swallowed tablets. Yes or no? Yes? Answer na. Would have swallowed or used tablets? Hello?
Yes, sir.
So what may be the dose would have swallowed? Approximately. Big tablets also you would have swallowed. Okay.
10
Sometimes
100
you would
mg.
have complained also. Okay. Nihal is telling 100 mg. Any other answers? Because some people would have complained also. You have complained to your parents telling that tablet size is too huge to swallow. Somebody has complained like that? You have some complaints?
Yes, sir.
Yes, sir.
ಅರ್ಧ ಮಾಡ್ಕೊಡ್ತಾರೆ ಸರ್.
ಏನಬ್ಬಾ ನಿಹಾಲ್ ಟೆಲ್
ಅರ್ಧ
ಹೇಳ್ಪಾ
ಸರ್.
ಅರ್ಧ ನುಂಗ್ತಾರಾ? ಓ Okay, so yeah, so all that issues you would have faced. For example, what can be the maximum dose you would have swallowed? Any idea? 100 mg is not correct, Nihal, to be frank with you. Any other dose? Girls can tell, boys can tell. Boys, no answers.
For paracetamol, 650 mg Dolo.
At least common sense, some people. Dolo, how much?
650,
for
sir.
example, all of you would have had fever. Yes? 650. Yes. Okay. Dolo 650. Excellent. Okay. So the maximum dose somebody can swallow, an adult dose I'm talking about, can be a maximum of 1 gram. Please note it down. Okay. Anybody will ask you this. Even if you go for a company interview, people will ask you. Okay. So the maximum dose is 1 gram. Is it clear? That is 1000 mg. So what will happen in case of the drug with ultra short half-life? When you want to fabricate or you want to develop such a, what you can call it as, dosage form, what will happen is the dose will cross 1 mg. That's what is the limitation. So they are unsuitable. Okay. And so the other extreme now. Okay. The drugs with long half-life, why they are not suited is my question. Any answer? Yeah, you have to reciprocate. Tell. Don't even worry if it's going wrong. I'm very happy. Okay, that at least you are making an attempt to think. Okay, I'm very happy if my students start thinking. Okay, even if it goes wrong, no issue. Okay, why they are not suited? Why you call it as not suited? Yes? Tell pa. Last class I told. Have a scribbling pad next to you. I'm not telling you to make notes. Yes? Not even 1% out of 46. Okay, almost 40, above 40 are there at least. Any answer? Attempt? Anybody can attempt? It's becoming too slow for me. Shall I proceed? Hello? Shall I proceed?
Sir, can you repeat the question?
No. Why drugs with long half-life are unsuitable? Like as you told, na? Short life. I just told you the reason. Okay, they may require huge dose. So drugs with short half-life are unsuitable. Similarly, drugs with long half-life also are unsuitable. Why so? Is my question. Yeah,
So
ma.
maybe onset of action is late.
Not late. You're somewhere closer, but you're not able to express it. Anything? They're somewhere closer.
Long acting, the drug half life is less than 2 hours, sir.
Hey, how long acting? Less than 2 hours, ma? Huh? Hmm? Okay.
So maybe
See
onset
there?
of action will be
Huh? Yeah. Not onset. You are all somewhere closer. Duration of action is
toxicity
longer.
will be increased.
No. Duration of action will be longer. That is exact terminology. Understood? Okay. So there is no need for you to develop a sustained release or a controlled release formulation. Is it clear now? Yes?
Yes, sir.
Are you able to understand?
Yes,
Yes,
sir.
sir.
So duration by themselves, okay, the intrinsic property of the molecule itself is such that, okay, they are long acting. So you give only once or twice a day. The conventional dose itself is given like that. Is it clear? So you don't require to develop a sustained release formulation out of it. Shall we proceed further now? Yes? Yes? So the best suited are the ones having short half-life. Having a half-life between how much? Yes? Which are best suited? I want answers. Yes? Which are the best suited ones?
3 to 4 hours.
Yes, excellent. Okay, drugs with having a half-life of 3 to 4 hours. That is the moral. Okay, that is the theme of the whole discussion. Okay, drugs having a half-life between 3 to 4 hours are well suited. Example of the drugs are, one is diclofenac. Okay, yes, there is something called aceclofenac. All these come under such category. You go and do a survey. For example, somebody can do a survey, okay, by collecting only the information regarding what are the control release dosage forms which are available in the Indian market based on a classification. Classification is, you know, the chemical classification, okay, based on the category of the drug. There's a classification, okay, something like antihypertensives, okay, something like anti-inflammatory, analgesic. You have the chemical classification. You study all of you. Yes, do you study? Hello, people have to reciprocate, otherwise it will be difficult for me.
So your voice is
Ah,
breaking, sir.
okay, no, do you have any kind of classification, either chemical classification, okay, or pharmacological classification? Which one you remember or study? Based on which you classify them into different categories. You study that? Hello? Hello? Hello?
Sir, we have studied, sir, but not remembering.
Oh, Yenappa. Where did you study? Either chemistry or even pharmacological classification?
In college, sir.
Okay.
Pharmacological
Then,
classification.
okay. So what people can do is, okay, you know the pharmacological classification now. At least go and refer. Okay, where you classify drugs into different categories. Okay, in each category, for example, okay, you see which drug is available in the Indian market as a modified release dosage form, that is as a sustained release or controlled release. Okay, Nihal can just help your friends in that direction. Okay, can you assign this to them?
Yes, sir.
Huh? You are interested or
Ah,
no?
yes, sir.
Yes. You're interested to know now what kind of products are there in the market. Tomorrow, some of you may become an entrepreneur. You need, okay, you need to do the gap analysis. You need to find out what are the products available in the market. Okay, some of my old students come and tell, sir, such a kind of product was never there in the market, sir. We developed such a product and we have become entrepreneurs. I'll feel happy. Do you want to take up such jobs?
Of course,
Yes.
sir.
Then,
Why not,
okay.
sir?
Yes. Yes. Yes or no? And now, for example, yes, Even during the COVID time, you can really make miracles. Many things you find out like they are not in place. Okay, simple hand sanitizer or sanitizer as such. Nobody is ready to make them. You got a huge market, you suddenly realize. Yes? Are you able to understand? Hello?
Yes, sir.
Hello? So always it is better that you product, especially for example, in case of product development, which is part of pharmaceutics, it's always better that, okay, that you come out with new products. Okay, you identify them and come out with new product. For example, there is no, for example, appropriate antiretroviral drug, which is going to cure what you can call it as COVID-19 right now. Any drug you have encountered which can be used? Yes. Any antiretroviral? Yes. Nobody has heard of.
Remdesivir.
All of you have heard of COVID? Huh? Hello?
Remdesivir.
Yes.
Favipiravir, sir.
Remdesivir? Remdesivir? Huh?
Favipiravir.
Huh?
Hydroxychloroquine.
Hello?
Dexamethasone.
Yeah, that's again a new molecule. One, I agree with you. Okay, so when you really want some new, excellent, yeah, you came out with at least few molecules which have been tried. Okay, but it is not proven. For example, hydroxyquinone as an anti-malarial. Am I correct? Yes.
Yes, sir.
Yes. Is it clear? Which again doesn't have any proof that it will act against the virus. Okay, similarly dexamethasone. What's the category of dexamethasone? Why others are more?
Steroid.
Steroidal molecule.
Okay, you would have studied dexamethasone of late in your B Farm only. Steroid. Yeah, used for no use. Yes. Any use is there or no?
Yes, sir. For aldosterone,
Hello.
I think, sir.
Okay, it is used as a painkiller. Yeah. Okay. So there is a huge scope for you people to find out what you can call it as develop a product. That's what I always feel. I'm very proud to be what you can call it as a pharmaceutical technologist even till date. Okay. This is the reason I'm telling you. And there is a lot of scope for you people to do patent also. That's why I always encourage all of you students to take up pharmaceutics. Is it clear? I being a head of the pharmaceutics department would like to encourage. Okay, this is the reason I'm telling you. Are you able to understand? Yes. So you should know what is there in the market, what not is there. Are you able to understand? Yes. Okay. For that, at least you should do the gap analysis. This is what is meant by gap analysis. So all of you will be able to do such things. Take up a project and do. Yes. People should reply.
Yes, sir.
Yes. So you need not do a big job. For example, yes, you are studying this particular chapter, what I'm dealing. Okay. So your pharmacological classification is already there in place. Okay, where drug is categorized into different classes based on their category. Take the same classification and among these, okay, see which one is available as a CR and or sustained release dosage forms. Are you able to understand? Yes. And prepare a report. Is it possible? You have something called practice school also this year. You have or no? Hello?
Yes, sir.
Yes.
But nobody is doing anything. Take the initiative part, do it first. Are you able to understand? All of you understood what you can do? Yes? Hello? You should reciprocate, otherwise it will be difficult for me to conduct a meeting. We
Yes,
consider
sir.
this as a meeting, not as a class pa. Each one should talk. Okay, why this is called as go-to meeting? Tell me. Why you are using this platform? It is basically to conduct a meeting. Are you able to understand, all of you? Okay, it's not like I keep on talking and you keep on hearing. Okay, it'll not fetch either me or you. Is it clear? So it has to be more interactive, especially the online classes. You can make it really interactive. For example, Nihal came out with some molecules and was very happy to hear. He kept telling hydroxyquinoline. He told dexamethasone. I'm very correct. Okay, remdesivir is one more. Okay, like that. I'm happy to hear. At least you students know that. So it has to be interactive. Unless until you make it interactive, okay, it loses its charm. What I can call it as. Okay, shall we proceed? Yes or no?
Yes, sir.
Yes. So you can take up Aditi. You can just take up such projects as a part of what you can call it as practice school, and you can prepare a 20 pages write up. Okay, which drug is available in each what you can call it as category as in SR, especially in the Indian market. Is it doable or not? Yes. Yes or no? Or you want to do something or no? Yes, Aditi, I want answer. Aditi and Nihal, I want answers. Yes.
Yes, sir.
Then you have to do something. Okay, after this year you're graduating out. Your parents are expecting something out of you. Yes or no? Yes? Hello?
Yes, sir.
Then you should do something, na? Okay, so you can do this. I am not at all insisting on that. You divide your classes into some groups. Maybe 8 category are there. You divide into 8 groups. Okay, each group will have around 3 or 4 students. Each one of you work on each category. For example, some of you can work on anti-inflammatory, some of you can work on analgesics, some of you can work on cardiovascular, okay, so on and so forth, anti-diabetic, so on and so forth, and finally pull it up and give everybody. Is it possible?
Yes, sir. I'll make a group, sir.
Yeah, please, pa, if you don't mind, because you are not involved in practice school also. Are you able to understand? Are you able to
Sir.
understand? Then you have to do something. And you need not go to the pharmacy to find out also. Okay. You can talk to your friends. You can mail your friends. Okay. You can refer online. Do anything. Are you able to understand? Are you able to understand? Yes?
Yes.
So like this, each category of drug, each chapter wise, you can do it. If if you are really interested. Okay. For example, always I keep telling transdermal is my favorite area because I work deeper and deeper in transdermal. Okay. It's a very niche area. For example, as you can see, very few transdermal products are available in the market today. Yes, but slowly you are able to see that few transdermal products are launched. Any one product that is launched? Anybody knows?
Sir, one thing I know that some vaccines
Hmm.
are also they are trying to give in transdermal patches,
Yeah,
but it is
nice,
in still
nice.
in research only, sir.
Okay, yeah.
Complete.
Otherwise, which is okay, good, good. At least you have made an attempt to learn whatever it is. I'm very happy for that. Okay, I went to US around 10 years back. Okay, and that is the area which I was offered to work on. There was no choice for me. Okay, that was a lab which was exclusively working on transdermal drug delivery. So that is the reason I identified my domain there and I have kept working there. Okay, so in India market, very few molecules are available as transdermal patches. Okay, new patch is one such example. NUPATCH. Okay, diclofenac sodium again, the same molecule is available as a transdermal patch. Like this, very few patches are available. Fentanyl patch is one more. Have you heard of the drug fentanyl? Have you heard? How many of you
No,
have
sir.
heard? Yeah,
I heard, sir.
fentanyl. Please, yeah, please refer. Yeah, what is the
Oh,
category?
opioid,
Anybody?
opioid drug.
Yeah, excellent, ma. Excellent, Aditi. Yeah, good. Okay,
Sir.
good.
Sir, one more.
Mm.
Bubadisic patch is there, sir.
Which one is that?
Bubadisic patch.
Okay, which is a drug?
I don't know, sir. I forget it.
Yeah, find
And
out
patch
now.
is there, sir. Diclofenac.
Yeah,
Okay, sir.
diclofenac. Yeah, maybe there are different brands. I agree with you. Okay, I'm just talking about molecules like this. These are known as, for example, novel drug delivery system. This is a chapter where we deal with, so far what I'm been dealing is control release. The other category, what you are going to study this year will be novel drug delivery systems. Okay, like this, Nihal and Aditi see that people work, prepare a report, one on control drug delivery, one on novel drug delivery. Is it clear? Are you able to
Yes, sir.
understand? So, for example, novel drug delivery system, transdermal is one such example, which come under novel drug delivery system. One more category is pulmonary delivery, okay, where drug is delivered directly into the lungs. Example for these products, such products are available even in the market. Okay, Indian market, it is there. Any idea of such products?
Inhaler, sir.
Inhalers. And there are something called DPI also, dry powder inhalers. Okay, so people can gather it. Yes, exactly, pa. Exactly. Yes, rotocap is one such category where, for example, you crush a capsule and inhale. Okay, so that is an example, classical example. So many of you, some of you know that. I'm very happy that some of you know that, but all of you may not know that. So you can work, some of you, okay, based on your pharmacological classification, what kind of products are available in the market. Okay, just like how people kept on telling now. Similarly, what kind of novel drug delivery systems are also available in the market? For example, DPI, all this will come under transdermal, all this will come under a novel. Okay, example even is ocular implants. Have you heard of ocular implants? Yes. Have you
No,
heard
sir.
of ocular it's nothing but
Somewhere,
nothing
sir.
big. Yeah. It's
I
ocular implants. Yeah, tell Aditi, tell ma. Yeah. Yes. There is some contact lenses. Have you heard of contact lenses? All of you would have used, some of you. Is it clear? There is something called even
yes,
medicated
sir. They're like they're
medic.
surgically inserted.
Yeah. You need not even insert them surgically. Okay, people wear contact lenses also. For example, it can be a
Yeah.
replacement to what you can call it as your own glasses many a time. Is it clear? So people have to just put it on and put it off. Okay. The only limitation with that is, for example, there is chances of dust getting accumulating. All those things are there. Is it clear?
Yes, sir.
That is the advantages and limitations of contact lenses. Similarly, there is something called medicated contact lenses also. Understood? Yes? Are you able to understand? Yes, pa, I want answers. Is the class interesting or no? Yes, tell pa.
Yes, sir.
Then, okay, you will be really astonished to hear so many products which some of you may not know. Okay, this is one such example I'm talking about. Okay, there are some, for example, parenteral preparation which are used for sustained release. There are one injections every 2 months. Have you heard of such injections? Yes? Yes or no?
Antibiotic,
People
sir.
would have not heard of. No. People would have not heard of insulin.
Yes,
Yes.
sir.
Yes, sir. Yes,
You
sir.
don't remember you studied insulin? Then what kind of insulin is that, ma? Tell. Okay, you would have studied. The teacher would have taught linte insulin. I don't remember those types of insulin.
Linte, ultralinte,
Yes?
semilinte.
Huh? Yes? Then all those are modified release, what you can call it as of the insulin products. Are you able to understand? Yes?
Yes, sir.
So many
Yes, sir.
diabetics are there in India also. Just find out who is using what and tapa. Can't you do that? Okay. Yes, you can sit at home and do and enhance your knowledge. Is it clear? That is all your expectations. Just think over and let me know. whether it's doable or impossible. Okay, if you people come back and tell me, Shukumar sir, it's impossible to do, Andre, we'll forget it. Are you able to understand? No, sir,
Yes.
it looks very interesting to do a gap analysis. I'm really interested to do because after my B farm or after my M farm, I really want to come out with some products which are not there in India, Andre. I'm very happy. At least few of you, if you are able to do that. Yes? Are you able to understand?
Yes,
Yes,
sir.
sir.
You're able to see the screen? All of
Yes,
you?
sir.
Yeah, we can see, sir.
Shall we proceed? Shall we proceed, ma? I don't know why my system went off. Okay. Shall we proceed?
Yes, sir.
So, understood. I debated a lot out of the topic today. Anyhow, okay, that is about biological half-life, and you came to know which are suitable or which are unsuitable. Both you studied. Okay. Now, for example, the next is absorption. I already spoke about absorption in the last class. I just told you. Okay. I just told you in the last class what kind of drugs, ideally speaking, okay, ideally speaking, the drug should be what you can call it as well absorbed through the GAT. Okay, yes, well absorbed through the GAT. If at all you want to formulate them as an SR. Okay, I think I told you this. Yes, you remember? Yes, yes, hello? You people
Yes,
who are
sir.
able to remember? Hello? So
Yes, sir.
ideally
Yes.
speaking, any drug that has to be formulated as a SR or CR, yeah, should be absorbed uniformly throughout the GAT. And even this, you people who are very familiar, I just told you, okay, most of the drugs what you're using today, 80% of them, 80 to 90% of them, I think I told you about organic acids. Okay, organic molecules. You remember? And yes, you remember me telling this statement? That is the importance of your organic chemistry. Okay, always study organic chemistry, will really come up in life. Is it clear? Hello? Hello?
Yes, sir.
Hello? Okay,
Yes,
so
sir.
I just told you 80% of the molecules are organic acids or organic bases. Okay, and you also identified and told me that I was very happy that acidic drugs are getting absorbed from which place? Hello?
Stomach.
Acidic drug, excellent. Acidic drugs are absorbed from the stomach, whereas basic drugs are absorbed from the
Small intestine.
yes,
Small
yes,
intestine.
small intestine. Excellent, excellent, ma. So, but there are certain exceptions. But ideally speaking, as I told you, for a drug to be a good candidate for an SR, a drug has to get absorbed uniformly throughout the GAT. That is, starting from the stomach till the small intestine or whatever it is. Is it clear? And we also saw what was BCS classification. Yes, you remember? Hello?
Yes, sir.
Yes,
Yes.
Yes,
sir.
sir.
BCS, yeah, BCS classification also we saw. And BCS classification is biopharmaceutical classification scheme, and where the drug is divided into 4 categories. Okay, class 1, class 2, class 3, and class 4. Class 1 is the one, for example, these are the drugs having, please jot down, please note down. Anyhow, I'm sharing the PPT, but still you note down. Class 1 are the ones which have got good solubility, good permeability. Class 2 is the one which have got the solubility as poor, whereas permeability is good. Class 3 is the one where, for example, solubility is excellent, but permeability is poor. And class 4 is the one where both solubility is poor and permeability is poor. Is it clear? Yes? Are you able to understand? Yes? Yes or no? Hello? I want people to speak out. Hello? Hello?
Yes, sir.
Yes, sir.
Yeah. So, and next is most important is this one, pa. Approaches in drug development, not design or drug development. It is actually okay. There's a small mistake in the title, approaches in drug development, because we only talk about here. Yes, how well the drug can be developed. For example, according even in this classification also, class 1 are the drugs which are most suited for sustained release, whereas class 2, okay, as I told you, has got what you can call it as solubility issues. So you have to do something to improve the solubility. So I've already listed out some of the approaches which can be used to enhance the solubility. And again, class 3 drug, for example, now the next is, yes, there are again some permeability issues. So something has to be done to enhance, some approaches has to be used to enhance the permeability. And class 4 are the drugs which have got both solubility as well as permeability issues. And there are certain approaches to improve both solubility as well as permeability. All those approaches have listed in a single chart. This is what, and the same chart is present in pharmaceutics lab 1. Okay, yes, all of you please note that, or you can always have this handy, so you can always remember. Okay, this should actually, you should be able to remember. Okay, it should get embedded in your brain, so that you should never forget this. So once you realize the importance of this, that is what is a basis classification. You can use this classification to develop molecules. Is it clear? Yes? Are you able to understand? Yes? Is it clear? Yes or no?
Yes, sir.
Hello? Am I too fast?
No, sir.
Was I too fast? Or you want me to
No.
repeat? Tell me, Pa, stop me if you're not a. So we'll move on to the next absorption. So we always tell, as I told you in the last class also, we always tell the substance has to get well absorbed either in the stomach or the intestine. There, that is what you got to study. So one step ahead if you want to tell. This is what you need to tell. For example, again, there is a mistake there. I'll tell you in the first statement what I've done. So you usually assume the what you can call it as the gastrointestinal transit time as 8 to 12 hours, and a compound having the half-life between 3 to 4 hours. Okay. So you have developed a product having a half-life between with a product having a with a compound having a half-life of 3 to 4 hours, and the standard gastric time is 8 to 12 hours. Okay. Then what should be your absorption rate constant? All of you have heard of absorption rate constant. Okay. Yes. So the absorption rate constant you would have studied in your biopharmaceutics, Ka and Ke. Do you remember? Yes or no? Yes. Elimination rate constant. Have you heard? Hello?
Yes, sir. Yes, sir.
People should respond. Okay, you remember that elimination rate constant? Yes.
Yes,
What is
sir.
the equation for
dP/dT.
Ke? Simplest equation for Ke. So what is the simplest equation, Nihal? How do you represent Ke? Is it related to half life? Anybody can answer, not only Nihal. Please. Please unmute yourself and try to answer. There's nothing wrong. Okay. Is it related to half-life? Elimination half-life? Elimination rate constant?
Yes, sir.
Is it related or no?
Related,
In
sir.
what way, ma? Any? Huh? Yes, ma. Hello?
Sir, it's directly proportional.
Huh?
It's directly proportional.
As if I'm able to hear some disturbances. Is it directly proportional or some other equation is there which you have studied? Even in my subject.
Not able to remember
Yes?
the equations, but
Yeah. Hmm.
maybe directly proportional, sir.
Opa. Huh? Is it such a complicated equation so that you cannot even remember? Please write down in your scribbling pad. K is equal to 0.693 by T half. What is that? Have you studied or no? Tell me.
Yes, sir.
Hmm?
Indirectly
Have you studied or no?
proportional.
Then?
In chemical reaction, we have
Then?
studied.
0.693 by? Even here you have studied. I think I've told that equation. Was it clear? So that is elimination rate constant. Similarly, okay, there is something called absorption rate constant also. Are you able to understand? Which you would have studied in biopharmaceutics. Please refer that. Okay. So the absorption rate constant should have this value. That is approximately 0.2. Please remember. Okay. It is given a range now. What I put up, it's a range. At least remember it should be 0.2, 0.2. Okay. So that around 80 to 95% of the drug is getting absorbed. That is what you have to ensure. Okay. You should not develop a controlled release product or a sustained release product which does not even release from the small intestine or even the stomach. There are chances, even companies also have done that. I've seen. Okay. Either there'll be an immediate release where it behaves like a conventional dosage form, or what will happen is the tablet will never get released. Both things are going to happen. Is it clear? Are you able to understand? Yes? Okay.
Yes, sir.
Yes, sir.
So that is known as either dose dumping or system failure. It's called as. Please remember the terminologies. The first one is called as dose dumping, where all the dose is released in one shot, or it is called as system failure. Is it clear? So sustained release, okay. The next point, the sustained release may not benefit compounds having an absorption window only in that is jejunum or duodenum. Okay, you have heard of active transport. Have you heard? I should learn from you. Have you heard?
Yes,
Hey,
sir.
your teacher would have taught you, ma. You would have heard of active transport, passive transport. Okay, what is active? Somebody, I also asked you and you also told me something. Okay, what is active transport?
Utilizes ATP.
Then any other thing? Any others? Yeah, any other?
Against the concentration gradient.
Yeah, some. Okay, it's against the concentration gradient. Excellent. Uses the ATP. Excellent. Has anybody heard of carrier mediated transport?
Yeah, through proteins.
Yes. So there are some carrier proteins which are present along the GIT. Are you able to understand? Some carrier molecules will be there. Okay. So the inner surface of your gastrointestinal tract can be called as the mucosal surface. Outer surface of your GI tract can be called as serosal surface. Okay. So the drug has to get absorbed from the mucosal to the serosal surface to get absorbed. That is what is called as absorption. Are you able to understand now? Yes. So your intestine especially is surrounded by rich blood vessels which surrounds the intestine. Did you get my point? Are you able to understand? I have not put the diagram here. Assuming that you people assume are already knowing that because you would have studied in your HAP. Yes? Yes? Hello? People are able to
Yes.
hear me? Hello? Yes? So your intestine will be there. Surrounding the intestine will be rich blood vessels. So the inner surface of the intestine is called mucosal surface. The outer surface can be called as serosal surface, which is in direct contact with the capillaries or the blood vessels. So absorption is a process where the drug can be moving from the mucosal to the serosal side. Okay, so carriers will be present. Okay, they are not present all along the GAT. That's what you can call it as limitations. Okay, carriers will be present only in certain regions of the GAT, especially in what you can call it as I have mentioned there, jejunum and duodenum, or some of the what you can call it as a region in where the carriers may be present in abundant quantities. Okay, for example, many nutraceuticals are absorbed only from these two regions. Okay, example, many nutraceuticals, for example, if I remember, okay, I have worked on nutraceuticals, drugs such as, you cannot call them as drugs, nutraceuticals such as iron, calcium, riboflavin, and several other vitamins will be absorbed only from what you can call it as either jejunum or duodenum. Is it clear? Are you able to understand? Yes? Hello?
Yes, correct answer.
Hello? Shashikala? Hello? Hello? Yeah, Nihal?
Sir.
Hello? You're able to hear?
Yes, sir.
Yes? Hello? Or no?
Sir, we can hear
People are
you, sir.
able to hear or no?
We can hear you, sir.
Yeah, good pa. Yeah, excellent pa. Yeah. So these what you can call it as transporters, they're also called as, are present only in certain regions of duodenum and jejunum. Example, transporters of most of the nutraceuticals. So if at all the drug is transported through any of these transport systems, okay, which are located only in particular region, okay, what will happen is your controlled release or sustained release may not be a good choice for you. Okay, because what will happen is your controlled release formulations will release the drug in a slow fashion or a controlled fashion, starting from the stomach till the intestine. Okay, so this approach may not be the right approach. So in that case, you have to go for what you can call it as a gastroretentive drug delivery system, which may be beneficial. What do you mean by gastroretentive drug delivery system? Any idea? Hello? Any idea about this?
So can you repeat it?
You can see on the slide. What do you mean by gastroretentive drug delivery system?
Like any
Yeah, ma.
implanting of any, sir.
Not implant, ma. Okay, it is nothing but the dosage form stays in the stomach, releasing the drug in a slow fashion. Okay, try to find out about this and come in the next class. Then we'll start rest of the chapter. Okay, is it okay?
Sir, is
Yes.
it about dosage form the capsule or the tablet floats in the GI fluid so that it stays for a
Yeah,
longer time?
excellent. Good ma, good Tanuja, good ma. I'm happy. Okay, but again, Tanuja can do a survey on whether there are any such products in the Indian market. Do.
Okay.
Is it clear? Are you able to understand? Yeah, ma. You should be knowing. You should know. For example, you should not remain blank. Okay. So Nihal and Aditi, are you able to hear me? Both of you?
Yeah, we can hear, sir.
Hello? Yeah. You can just percolate to your friends also. Okay. To prepare a compilation. Okay. About what kind of sustained release or controlled release products are available in the Indian market. Okay. make a compilation around 20 pages. Okay. So half of the class can do about only control release or sustained release. The other half can do about novel drug delivery systems. Is it clear? Are you able to understand?
Yes, sir.
Yes? It's a good one. For you also, you'll learn. Otherwise, you may not learn. So the rest I'll try to continue in the next class. Is it fine? Yes?
Fine, sir.
Hello?
Yes, sir.
Okay. People are able, people are able to hear me. People are able to understand. As if there is some problem with his audio system there. Whenever he tries to talk, I think there's a disturbance. So are you able to understand? Yes, Tanuja?
Yes, sir.
Yeah, ma. Good pa. Nihal, ಅರ್ಥ ಆಗ್ತಿದ್ಯಾ?
ಹಾ ಸರ್ ಅರ್ಥ ಆಯ್ತು.
Yeah, good pa. Please refer immediately so that whenever whatever class I handle, so that it remains fresh in your mind there itself. Anyhow, I'll be sharing the PPT. So everything is there in Banker, but it's a huge book. Whoever is able to read it will be quite excellent. Okay, is it clear? Yes. Are you able to
Yes,
make
sir.
an habit to refer such kind of books, especially in the college we have an excellent library, as most of you might be knowing. Our library is one of the excellent library, the best in Bangalore. I'm telling you, no other college has such an excellent library as ours. Okay, you have to be really fortunate. People will not understand whenever they are doing their pursuing their B Farm or M Farm. Is it clear? Yes, it's huge resources what we have. Is it clear? It's left for you people how best you can utilize our library. Understood? Yes. Sky is the limit if you really want to grow. That's what. Yes. Alumni of this college, as you know, okay, have really reached great heights, as you were seeing. Is it clear? We always wish you people also become one of them. Is it clear? Are you able to understand? Yes. Hello.
Yes, sir.
Okay, pa. I'll see you in the next class then. Okay.
Okay.
Take care, all of you. Take care, ma. Take care. Bye. Bye.